morning, students. Today is the communicable disease. There are so many communicable diseases there. First is the measles. Measles is a highly infectious disease of childhood caused by the measles virus. It is characterized by the fever, symptoms of the upper respiratory tract followed by the typhoid rash. In our country, it is a major cause of ill health and morbidity. Next is the epidemiological factors. The causative agent of the measles is the specific measles virus, RNA virus of the morbillivirus of the paramyxovirus family. Human body is the body reservoir of this infection. The one sources of infections is the causes of measles. Next is the mode of transmission. A mode of transmission mainly by the droplet infections or droplet nuclei. Portal of entry, it is a respiratory tract and sometimes through the conjunctiva. It can spread directly by a airborne route or by the indirect contact with the fomites. Incubation period is 10 to 15 days. And the measles usually occur in the children between the age of 1 year and 5 years. It is below and 5 years. Infants are protected by the maternal antibody up to 6 months of age. It is rare in infants of 6 to 12 months. Before 6 months, it is uncommon. It may be found around 6 months in mild form. Sometimes it may occur in the older children. The disease is found in very severe form in malnourished children. Next, the clinical manifestation. Clinical features of measles are manifested in 3 stages: prodromal stage or pre-eruptic stage, eruptive stage, and convulsions or post-measles stage. Next, see the stages one by one. First is the prodromal stage or pre-eruptive stage. Prodromal stage usually start after 10 days or infections and last 3 to 5 days. This stage is manifest with a fever, malaise, sneezing, nasal discharge, lymphadenopathy, vomiting and diarrhea. Coplic spot. Coplic spot means spot looks like a small bluish white spot with a red background of the inside of the cheek. Bracy cough, redness of the eye, lacrimation of the and photophobia. Eruptive stage. Eruptive stage is characterized by the typical irregular, dusky red macular and maculopapular rashes which are found behind the ear and the face first, usually 3 to 5 days after the onset of the disease. Then is spread to neck, trunk, limbs, palms, and soles in next 3 to 4 days. Fever usually rise again or regress gradually within 3 days. Anorexia, malaise, and cervical lymphadenopathy and may present. Fever and rash usually disappear in 4 to 5 days in the some order of appearance. There is a fine shedding of the superficial skin of face, trunk, and limbs, leaving brownish discoloration which may persist for 2 months or more. Investigation usually clinical features help in diagnosis, no investigation needed. But serological test, viral isolation ELISA test to detect the presence of measles antibody and a routine blood examination can be done. Complication of measles are potentially dangerous and the fatal than the disease. The common complications are the respiratory tract infection. This means bronchopneumonia, laryngitis, tracheobronchitis, bronchiolitis, activation of primary tuberculosis, otitis media, mastocytitis. They are most common complications causing long-term complications. Gastrointestinal complications is single persistent diarrhea, appendicitis, stomatitis, meningitis. Other complications are the myocarditis, acute glomerulonephritis, DICs, and bleeding, diabetes, keratitis, and corneal ulcers secondary up to the vitamin deficiency, malnutrition, etc. Management. There is no specific management for measles. The symptomatic management is done with the antipyretic, antihistaminics, antipyretics, cough sedatives, vasoconstrictor, nasal sprays, and vitamin A supplements. Antibiotics may be given in the spread bacterial infection. The uses of antiviral drugs, gamma globulin, and the steroids are double full. The preventive measures acute immunizations with a live anti-neural measles vaccine is administered 0.5 ml of sub subcutaneous is a single dose 9 to 12 months for age. Booster dose of the measles vaccine is new recommended at the age of the 16 to 24 months. It provided protection to the susceptible children for the lifetime. MMR vaccine is mumps, rubella vaccines that were administered for protection against the measles along with mumps and rubella. Prognosis is a well-nourished child with measles is usually good. Measles is self-limiting disease unless in the complicated. Approximately 90% of death may be occur in severe respiratory and neurological complications. Survivor of the post-measles long-term encephalopathy may have the neurological death. Okay, thank you so much.